Good evening, everyone. My name is Brenda Ahlberg, Information Officer for the Kenai Peninsula Borough, and thank you for joining us tonight. With me tonight is Dan Nelson, our Incident Commander. Good evening, Dan.
Good evening, Brenda, and good evening, everybody. So I've got just a few updates and some things to start us off, but I think we'll also be monitoring this thread for questions. So please feel free to ask your questions. If we can answer them, we'll definitely go forward and get you that information here just as quick as we can. Let me talk a little bit about what's going on from the borough perspective. So if you've been tuning in the last two nights, you've seen great guests from South Peninsula Hospital and Central Peninsula Hospital. I'd like to thank Bruce and Dorotha for joining us and really providing information from the hospital perspective, because this is such a, this public health emergency is focused so much on our healthcare system and so much on avoiding the surge or that additional load on the healthcare system, that it's what we're really looking at as emergency managers on a local, state, and national level. So they provided some great information, and that's what we worked on today. We heard about this concept of alternate care sites and some of these other tools that are being used to kind of relieve that burden, to make sure we have an additional buffer in our healthcare capacity. So as we worked with Central Peninsula, South, and also with Seward Providence, our three main hospitals on the Kenai Peninsula, that's what we really focused on today. Not only alternate care sites and capacity, but really as we start talking about what some of the long-term issues are with this incident. Tomorrow, the governor has indicated that their press event is going to talk about some of the models and some of the statistics that have been put together, and we'll be hearing more about that from the state level tomorrow. But if you've spent time on the internet and different things, you've seen different models and you've seen all kinds of predictions and different data points. And, as we know, some of them are probably more accurate than others, but also they are subject to interpretation. So we know that not one model or one statistic or one report is a perfect tool, but we've been trying to look at that and trying to look at what the long-term down the road looks like. So we'll be getting more on that. I'm sure we'll be talking more about that in the days to come, especially once the state has released some of the things that they're looking at. But know that your local incident management team, your local hospitals and cities are doing the same thing. As far as a case update today and developments, 143 total cases statewide was today's announcement. So for positive cases, we have 143. We did not have any new positive cases on the Kenai Peninsula. So that's still holding there. Other than that, it was a good day of a lot of long-term looking forward and basically just trying to work through some of the data and work with our state partners and all the other local partners throughout the Kenai Peninsula. So that's what your incident management team has been working on today.
Thank you, Dan. Some of the topics that have come up is some of the rumors are either recirculating or coming to light that may be causing some confusion. One of them is the National Guard. That's a post that was circulated mid-March. Can you tell us a little bit about that being a rumor?
It is, and that's something that's important, that when we talk about some of the assets and some of the folks that are activated, there was some information out there that the National Guard is in some of our communities, or they might be maintaining security or doing some other type of work. That's not true. The National Guard is not in our communities, so that is simply a rumor. Now, remember, the National Guard has been mobilized in many places to help with things or logistics, but that's not what these posts are alleging. So that's something important. And then tying onto that, there's also been some other things on social media about law enforcement officers, such as the troopers or city police, having checkpoints or other types of stations as a result of the governor's mandates for us not to travel in between communities or be traveling for non-essential work. And law enforcement officers are able to check with you and find out where you're going and enforce those types of laws. But the law enforcement officers here are focusing on education And that's something they have the ability to do, but they've told us is really not their first priority. We want to make sure that people understand why we're asking for these things, and not trying to be punitive. So there are no travel checkpoints or other things on the Kenai Peninsula from a state trooper or law enforcement perspective either.
And just another note, if and when the National Guard is ever activated, that comes from the governor's office. It's not going to come from a Facebook post that you are supposed to share with your family. So that's another way of also knowing that it is definitely a rumor or a scam. Speaking of scams, there's also of note that the scam, if you will, that you can have a test mailed to your home. Is that true?
Unfortunately, I think we all know that in times of crisis, some of these scammers, for lack of any better word, or untruthful people are going to be out, and they're going to be trying to do things, to take advantage of the situation. So we heard a little bit about this from Bruce Richards last night from Central Peninsula Hospital. Testing must be done by a referral from your provider, from your physician, your healthcare provider. There is no test that you can take at home. There's nothing that you're going to be able to get in the mail to be able to then somehow find out that you have COVID-19 or do anything like that. Some people are purporting that there's cures or other products that will take care of it, will cure you of COVID. There has been nothing approved at this point. It's something that we need to be very, very careful of as a community of these testing things and some of these people that may simply just be trying to get your money and to prey on fears. There's things in the news, we've heard about different things about different treatments. FDA is looking at some of this, but no, you can't have a test done in your home. That's going to be done at a testing facility or the hospital, and that will be done in cooperation with your physician. As we talk about those scams, remember to just use good common sense when we talk about those things. If you get solicitations of donations for some sort of COVID relief or something along those lines, it's important to be careful on those things. If you receive an unsolicited phone call or an unsolicited email asking for donations, that's something you need to be wary of. If you're interested in helping, there are national organizations and some of those that certainly are legitimate and doing good things. But that you want that to be something that you initiate. You're visiting their website or you're calling them, not the other way around.
And those links that Dan is referring to are on our blog for credible volunteer or even donation sites, including some of them that are local. So please check our blog for those credible links. So we understand that no, you cannot buy tests from the home. You cannot buy any kind of online vaccines from home or to go to your home as well. And then there's also, and I understand, emails that are circulating that seem to be from the Center of Disease and Prevention Center, or as we call CDC. Can you talk a little bit about that as well?
And kind of along those same lines, how do you get verified information? And I'll remind you that these scammers are very, very good at taking logos and making these emails seem very legitimate. There may be links in those emails that are taking you to a website that may look just like the CDC website or another website of a government agency, but it's not. And they're trying to either get money, they're trying to collect personal information. Remember to look for those official sources of information. So that's not going to arrive unsolicited in your email box. Just like we just talked about, the National Guard is not, coming from a social media post. So really, it's very, very important to stick to those verified sources of information. I'm going to tell you where, of course, the best one I think is ours, kpboem.com. Remember, that site will collect legitimate, verified information from local and state agencies, and we'll post that on there. And we have links to many of those agencies as well. You can also go directly to the CDC website, the Center for Disease Control, cdc.gov. The World Health Organization, I believe that's who.int, or the State of Alaska website. It's coronavirus.alaska.gov, but you can check kpboem.com. We have that link when you go to those websites, when you follow those links from a trusted source, you know you're getting verified information. It's just an unfortunate sign of the times that those copycat websites or things are out there. And I'll take this moment, it's not about COVID, but remember, if you get an email that you're not expecting, don't click on anything. Don't click on any links. Really maintain your situational awareness in a time like this where, again, people are simply preying on our fear, preying on our anxiety to try and take advantage of the situation. So kpboem.com. Bookmark that, put it on your phone or in your favorites, and there will be legitimate links to all of those organizations that you can get the information that you need, as well as volunteering and donations.
Thank you for that clarification. It is certainly a time where folks are concerned and want to do the right thing. Looking at some of the comment threads, it's kind of quiet tonight, which is awesome. Sounds like we're doing our job of getting folks the information they need. But one question that did come up is, have we thought of using the college dormitories for overflow or emergency purposes?
Thanks for that. As far, I don't believe the college dormitories, I'm assuming that the ones up here at Kenai Peninsula College is what the folks are referring to. I don't think that's come up in our planning. What we're doing right now is there's a couple different things going on. We're looking at different sites and kind of putting some of our specifications together for what a site might be for overflow or alternate care, or perhaps for some alternate housing or sheltering, whatever those contingencies that we're thinking of. We know we need facilities, and we haven't looked at that one, but we've gotten several others that are in different areas of the peninsula that we've looked at. We've also gotten a lot of phone calls from property owners and business owners that are offering to donate sites that we may be able to use for different purposes. And again, thank you to everyone in the community that's reaching out and really providing, volunteering those things. So that's something I will add to our list for our logistics folks to look down and see if that's a possibility. Of course, we want to work with Kenai Peninsula College and those types of folks, but that could certainly be a possibility. We'll have to look into that a bit more. So thank you for that suggestion. We'll follow up.
Thank you. And it's very quiet out there. We've got a few folks reminding our audience, take this seriously. We want to stop the spread. And for those that may be coming home, to do the right thing and stay in your home and self-isolate. So I think that would be a great way to close the evening, is why it's so important, and call it an early night for ourselves, for our viewers as well.
Absolutely. So we definitely want to be respectful of your time. So we'll start closing this out and see if there's any kind of last questions. But really, I think the commenters and some of the folks that are reminding everybody how serious this is. I mean, and I think I mentioned this the other day, and I'll be honest. From my perspective as an emergency manager, I look out my window here, I see a lot more traffic than I would have expected right here in downtown Soldotna. And I haven't been to many of the other areas, but reading things, it seems like there's still a lot of people out and about. The governor's mandates have asked us to restrict our movements for essential business if we're working in an essential industry, or for those critical personal errands. And I think really it's time for us to really critically think about how do we define those things. We're kind of asked to define those with examples ourselves and be adults and be Alaskans and have that good judgment. But, is that trip really necessary? Every time we go out, every time we potentially have contact with another person, that's potentially a piece of the spread. And again, as I said before, the healthcare system, if one or two people break their arm in a day, that's not really any big deal. Our hospitals and physicians can handle that with no problem. But what if 20 people break their arm? It's a little bit harder to get in and to get our surgeries or get our x-rays or all the things that we might need for that type of care. So that's exactly the same thing as we're talking about COVID. If we have that surge, if we all of a sudden have a great amount of people, we haven't stopped that spread, we didn't flatten that curve, and that curve starts going up, what's going to happen to our local healthcare facilities? What's going to happen to our physicians and our nurses and our technicians and all of those people that work when we have a medical issue to take care of us? We're putting them at risk. we're putting the system at risk. And then as we talk about, what about our fellow citizens, not only those folks that may be infected with this virus, but what about those folks that have other medical needs? And because that system is being overwhelmed by the virus, somebody that may need care may not get it as effectively, may be harder to provision. It's not a doomsday scenario, and I'm certainly not trying to make it that way, but those are the realities that we start to think about. We have a finite capacity, and although we're working with everybody in the hospitals and the medical profession is doing a great job to expand it, it's not unlimited. Think about that the next time you go out, please, and remember to encourage your friends and family to do the same thing and to flatten that curve. We'll get through it. I understand that we're looking at a longer timeline. It's been a tough couple weeks already. I get it, but please help us help you. So I think that's a good place to leave it, though. But Brenda, if we have any more questions, we'll be certain to answer them.
Just a couple comments. Folks are wanting to say that they agree with you as far as driving around. Sometimes they feel like they just need to take a drive, catch some fresh air. They want you to know that they are following the mandates, but they just feel like they need to go for a drive. And I appreciate that clarification that a few folks have made too. And then, of course, Mayor Pierce has popped on here. He wants to let everyone know that we're doing a great job, but also that the communities are doing a great job. And that's something I know that he's shared with you even today about. He appreciates the fact that our communities are doing a good job with this mandate.
They absolutely are, and really everybody is contributing to that cause. And again, we're all in this together. It's hard for us to sometimes see that. So, I definitely understand people out for a drive and doing those different things, but we really are, and we just need to continue doing that great job, and we'll, like I say, we'll get through it. We really will.
And on that note, we wish everyone a good night, and thank you so much for taking time out of your evening to join us tonight. Good night, Dan.
Good night, Brenda. Thanks, everybody. Have a great evening. We'll be back here at 7 tomorrow, I believe, with some guests, so look for that. Thank you, everybody.